Hello, good afternoon from Westbourne Medical Centre. My name is Steve Williams. I'm a clinical pharmacist here at Poole Bay and Bournemouth PCN. You'll be hearing from Dr. Lawrence Brad later in the afternoon, and I've worked here with him and the rest of the partners since the first NHS clinical pharmacist pilot in 2016. So, sorry I can't be there. I'm running a polypharmacy learning set in Exeter as part of my Health Education England role, but I was asked to talk about my journey since I started here working in general practice in 2016. So just by way of introduction, there are 4 things that I wanted to say in relation to introduction. The first thing is that I guess like most people in the audience, I've been in the NHS a long time. I'm in my 30th year. So again, like most people, I am an NHS believer. That's the first thing I would say. But of course, pharmacists are trained differently to other health professionals, and I think that's what we're trying to embrace here. And so I always think of, on a very simple level, doctors for diagnosis, nurses for nature, and pharmacists for pills. But of course, we're all now in a modern world where we all need to do all of those things. Some have better expertise in some rather than the other, but we're all trying to do the same thing. The second thing is therefore that pharmacists are different, and pharmacy technicians, in that we're medicines experts. So again, it's very different, and the world is much more complicated than it ever used to be. And so you well know that medicines are the most common intervention in healthcare across the world, and therefore they pretty much deal with most patients. And you'll also know that we're currently in the perfect storm, aren't we, of aging population, multimorbidity, polypharmacy, the subtlety and complexity of medicines getting greater. May I say, having worked in hospital, that silo working, specialist silo working that tends to occur in acute hospitals these days. And also, because I'm very interested in medication safety, that there's a World Health Organization and in fact a Department of Health plan to try to reduce avoidable severe harm due to medicines by 2022, I think it is. So I came from a background of working in hospital for most of my life, and I only started working in primary care in 2016. But again, like most of you in the audience, I've also therefore over my career been witness to lots of change. And so I think there's going to be some sniggering in the crowd as we say this, because if we work in the NHS, we know that the only constant is change. And again, like lots of people, I've worked with everybody on the innovation curve. I've worked from the laggards to the early adopters. It's actually that way around, isn't it? And everyone in between, and there are all the personalities that go with it. But I'm absolutely convinced that if you get the right people in the team and you get the right people doing the right jobs, that you can pretty much do anything you want if you resource it and have a focus about what it is that you're trying to do. And the fourth thing I'd like to say, and this has really become my mantra probably of the last 15 years, is don't find fault, find a remedy. Anyone can complain. And that's a famous quote from Henry Ford of the Ford Motor Company. So that's my attitude. I am an eternal optimist, but hopefully I'm going to present to you a little bit about my journey. And if you can see this slide here, this is just the scale of the problem, which, as I said, is the perfect storm in relation to the use of medicines in the new decade of the 2020s. And it's not going anywhere. It's only going to get more difficult. And so from my point of view, if you don't have pharmacy professionals working in a modern PCN, then you're not going to be able to deliver the care that you want. So when I first started doing these sorts of presentations, people say to me, well, what have you learnt then since you started working in general practice? And this slide, if you can see it, pretty quickly, I would say within a year, and I would say at this point that I didn't see a patient face to face for a whole year. Okay, I've been in this post nearly 4 years, 3.5. And I did not see a patient face-to-face for a whole year, and I'll talk about that in a minute. And I found that very, very hard, but this is what I did learn within sort of a year or 18 months of working in general practice. This is here. I am constantly on the clock, like all of you. I've never known anything like it. I feel like I'm on the clock all the time because of this amount of work and the time that appears to be, not there to be able to deliver all this care. I've also found that there's nowhere to hide. So these patients are our patients, and no matter what we do, they will come back. It's not like a hospital where we may never see them again. This is about how good your IT is. So we may have moans about the IT, but compared with working in a hospital, your IT is outstanding. and the ability to see all the things that have ever happened to that patient so that I can make really good decisions about medicines. It's all there, and it's only going to get better in Dorset because I know we're working on it. And the last thing here is, again, that we need to think of this as a marathon, not a sprint, okay? There's very few things apart from an acute medical emergency that are really to do with a sprint in medicine and medical care. So that's really my thoughts. So I don't think I'm going to dwell on this because I think most of you have already got pharmacists and pharmacy professionals, so pharmacy technicians I include in this as well. And this is the whole list of things that pharmacists can do within either a practice or within a primary care network. And so clearly we found that, and all those people who've also had pharmacists, they really like it. Okay, not everybody clearly, because nobody likes everybody, but patients have really liked it when they've had access to clinical pharmacists. Yes, there's loads of work to be done about medicines reconciliation. We can do appointments, both telephone and face-to-face, so I'll do telephone appointments. Started doing those, part of the duty team, and then later on we set up face-to-face, which Lawrence Brad will explain later this afternoon about medication review. R stands for results. That isn't just we can review results, but also if you never worked with a pharmacist, they're quite anally retentive, if I'm honest, but they will get results. They're very focused on results, so I think you will get results. Here, clearly the medicines optimisation agenda is massive, so whether that's Dorset, PCN wide or national. And again, care homes, big focus. A lot of you will have care homes pharmacists. I, or pharmacist, stands for integration. So for me, going back to medicines expertise, this is the pharmacist being the integral focal point of things to do with medicines within a practice or now within a PCN. And I think that people who've never had that, they come to really value it. And again, I expect Lawrence will talk about that this afternoon. I've already mentioned the scale of the problem. In my view, it's an absolute necessity to have pharmacy professionals working in PCNs. It's a no-brainer. And the other bit about time is that we have dedicated time. If we're used appropriately, we're going to have dedicated time to do the sorts of things that other people can't do, and we're better trained and better suited to do ourselves. So I was asked to speak specifically about my journey, and so I thought long and hard about this, and I knew this would be a hard presentation given that I'm not there. So I decided to take the title and to do it a little bit quirky. So hopefully you'll bear with me. So I want you to have a think about some of the great journeys that you've done in your life, okay? Obviously not in health, but think about what are the elements for a great journey, okay? And I'm going to give you a medicines optimization journey, if you like, from when I first started here working in practice. And this practice at Westbourne already had clinical pharmacy sessions, so they were exposed to and saw the value of early on. So first of all, I'm going to say that for a PCN, you are going to need a vehicle, and therefore you're going to have a pharmacist. You're obviously you're going to need a pharmacy technician as well, and you may need multiples. But first of all, I'm going to go for a pharmacist, and there'll be much debate about e-cars and autonomous vehicles. This is the next generation Tesla, and there'll be all this talk about well, what's the value or what's the price? But there is going to be an element here of you get what you pay for. And if you want something that's able to take you on that journey and do all the things that we're going to talk about, then you're going to need to invest, but you're going to get your value back from that, okay? And there's no point us looking backwards. This is about the future. This is the next 10 years, and this is the future of car travel for sure. So, second thing up would be, clearly, you don't go on any journey unless you've already planned what your route is, okay? So whether that be through the NHS plan, through the QOF, through the DES, which I'm not going to talk anything about, and I'm not going to be there to see the debate, but clearly we have to have a plan, and so otherwise you're never going to get there, okay? And you might need to decide how long is it going to take you to get there and set your expectation, because for some it's going to be, you might be able to achieve it by next April, and for others it might be the April after. And so when I first started here, and I'll talk about some of the things that we've done, I didn't see a patient for a whole year because I spent the whole first year pretty much learning how the practice worked and looking at the systems to do with medicines and doing masses of work around the prescription policy, which all the members of the staff will tell you made a massive difference, from the GPs right down to the prescription clerks and all the girls on the desk. So clearly we need a plan, and we have it laid out. It's not always straightforward. And then we need fuel for any journey. And Lawrence and I talk about this a lot. This is Lawrence's one of his buzzwords. and particularly in general practice, and I've seen this and the pressures of partners, the resilience to be able to deliver, to be able to go on this journey. And so I'm calling the fuel the resilience. And again, Lawrence will talk about how having other members of the health professional team who are all trained slightly differently but bring different abilities as well as training. And so the fuel is the resilience. Then what about things like dealing with disruption? So, you know, whether it's about weather or breakdowns or accidents or just traffic. And this is where we're going to need to, and I'm not suggesting that these people cause the disruption. My point here is that we're going to need to work with these people to circumnavigate some of the problems that exist. And obviously with Dorset being an ICS, we're in a really good position to be able to do that, or we should be, because of, you know, if we can't do it in Dorset, then nobody's going to be able to do it, let's face it. So we're going to need to work and deal with all of these partners in a collaborative way. I'm seeing, for example, about Dorset Healthcare, and I see this change with Andrew Williams came in recently, the community geriatrician, and was saying there's a real appetite for change in understanding that there's no point Dorset Healthcare making decisions without understanding first from the point of view of general practice. And so I think this is really important. And clearly the Dorset ICS has a plan around medicines optimization being led by Catherine Goff, and I'm sure she'll share this with you later. So we have got a bit of a plan, and there is some collaborative working to draw that up. Whoops, technical fault. Bear with me. There we go. So what else do you need? Seamless. What else do you need on your journey? Well, I think journeys are much better if you've got companions. Okay, so you need companionship. So I said before that I spent the first year of my working life here in general practice really understanding that how medicines fit almost like a thread throughout the whole of general practice. And Lawrence talks beautifully about how Heathrow Terminal 5 was brought to its knees within the second day of opening because the conveyor belt for the luggage went down. And he has this brilliant analogy about if you don't get the prescription system sorted out, it can bring the whole practice to its knees. So companionship is really important. So prescription clerks, technicians, I mean pharmacy technicians, as well as technicians who, you know, for example, see the diabetic patients and do the bloods and the weights and the foot checks so that then we can see them afterwards. Obviously all the different AHPs. So we've got all the Ps here. We've got paramedics, we've got physios, we've got nurse practitioner, advanced nurse practitioners. Clearly practice management themselves. Vital to have IT and QI team involvement because all the things that we've done, although I brought a slightly different thinking to it, we can't do any of them without the involvement of the IT and the QI teams to be able to do that. And I'll talk a little bit about those when I come to the next bit. But clearly the GPs themselves, the partners, the partnership, and also community pharmacy, because the big part of the difference about PCNs now is going to be about working collaboratively with community pharmacists as well. So somebody's going to have to lead all that, somebody's going to have to do all of that, and that person I believe is the PCN pharmacist who will be able to deliver or help deliver that. Obviously critical, low carb, obviously low calorie, low fat, low everything, but you need food and drink, don't you, if you go on a journey. Now you might think this is really cheesy, but for me, and certainly Ian, who's in the audience, I'm sure our practice manager, he understands this as well. This is data, this is metrics, and this is the food, okay? If we don't have any idea of what we're doing or trying to get, where we're trying to go on this journey, then we're probably gonna fail, aren't we? We're probably gonna have set the sat-nav to the wrong place. So this is a really beautiful slide. You don't need to look in too much detail, but this is from January 2018 to December 19 of all online prescription requests at Westbourne Medical Centre. And the green line indicates the total number of requests as we've pushed online, but it also shows at the point here in May 18 where we started to use the prescription clerks because we adequately trained them to take on, and then the blue line shows how they then started to take more and more of the online prescription requests on, and the yellow line is myself and Darren, the pharmacy technician, and how our work went down and it originally still carried on plateaued, but all the, if you like, all the stuff that can be done by somebody else has already been taken out. I don't have on here the queries for the GPs, but Lawrence will tell you over lunch or break that those numbers went down significantly for them as well. So without data, we can't do anything. So here's another one. We spent a lot of time looking at medication review and trying to get GPs to see the value of, if you do that kind of thing, then actually it's an investment in time to save time. And so when we started looking at whether or not people who are on more than 5 medicines had a medication review documented, this started in March for 5 months, and I've blocked out who the different GPs are. But if you see, so blue is yes, they've had one, and orange is they haven't. And then here we are 5 months later, and everybody's gone up, as well as the overall practice. And so when we deliver this data by partner, I started giving them anonymously, then they said, nah, come on, let's have them, we want to see it. And that's peer pressure, and peer pressure is great. So without data, then I don't think you're going to be able to make a successful journey. Here's another one, which is looking at antibiotic usage. And again, we need lots and lots more data analytics, I believe, from the CCG and the ICS in Dorset, so that we can individually plot. So here's Lawrence's antibiotic prescribing, sorry Lawrence, in green, but he's actually a positive outlier, okay? Whereas these people up here are negative outliers. So funnel plots are brilliant. So you need data, and again, Lawrence will talk about this later, but this is the polypharmacy comparator data telling us how good or bad we are in comparison with everybody else in relation to people on more than, this is the number of unique medicines per patient. So, we've done a lot of work on this, so we're actually as far left as you can go in the over 85 group, for example. So you need all of those things, and I think lastly I would say you need breaks. If you're going on a long journey, you need breaks. And I don't know about you, but I don't think anybody does well if they get asked to do the same job, exactly the same, every day, every week, okay? You need enrichment. You need your job to be different. So if you're the PCN pharmacist, you need to do some medication review face-to-face, you need to do some telephone appointments, but you also need planned time to be able to do the strategy of how are we going to change things, how are we going to integrate. And so for example here, and Lawrence will talk more about this, but how we looked at diabetic and COPD patients because of my background of working with diabetic patients. And we actually ended up changing the whole way that we called people and whether they even had to come for a face-to-face review, just because I was thinking about it in a slightly different way and we were able to change it. So you need job enrichment. Everybody needs that, I believe. And the good old informal coffee meeting chats, I think, are invaluable in all of this. And of course, then you will arrive refreshed and pretty much ready for everything, right? So this is my final slide. So again, this is something I feel really passionately about, and I think that you're going to need pharmacy professionals. They're a necessity, not a luxury, in this new general practice journey of the 20s. And I think that if you embrace the skills of pharmacy professionals, not only can they act as the collision avoidance technology with my autonomous vehicles to prevent problematic polypharmacy in older age, because that is going to be a big part of what we do. And we can also help PCNs, I think, undergo the necessary road redesign, which is the system change. We're not going to get autonomous vehicles unless we change the road. And we're also, hopefully, and Lawrence will talk more about this, allow for an improved battery life and therefore an increased resilience to be able to get there. And ultimately, I think that that will provide better patient care and safeguard perhaps the future of general practice in the 2020s. Thanks very much for listening.